Your time now, 6:14. Adults go to the chiropractor all the time for minor adjustments, but now more and more parents are taking their babies in to get their spines aligned. But does it really work? WAFF 48's Bobby Shuttleworth went out to find out in this special report, Adjusting Your Baby.
Let's see if we can get a little bit of move right in here.
17-month-old Mally Hudson gets a regular alignment from Dr. Laron L about every 2 weeks. Her mom says there are a couple of reasons for the visits.
It started as constipation issues that she was having, and those have really cleared up, and he makes sure that she's in alignment and everything to keep her in balance.
That balance includes typical infant maladies.
She had problems with ear infections, and we have really seen a change and a difference in not having to go get tubes put in her ears, but this has been a great alternative medicine.
She says life before was stressful.
Before we were literally at the pediatrician's office probably once, if not twice a month for an ear infection and on antibiotics.
I don't take the place of their pediatrician. They should still see their pediatrician by all means.
That's great.
And the American Academy of Pediatrics also recommends parents still use the pediatrician as the primary physician. It also cites a clinical report on alternative medicine in general, saying additional studies are needed.
There are actual medical studies that show that babies do respond well to chiropractic treatment for ear infections. Probably the most emotional thing that I treat is colic in infants. And colic is a big problem.
Hardy says his own child had a problem with colic.
I use a treatment called CRT, colic release technique, which is a 10-step procedure that I can teach parents to do at home. It's an ongoing procedure.
He says any layperson can do it once they know the landmarks of the spine in the abdominal area. Dr. Melissa Young-King is a pediatrician who says chiropractic therapies on children can be beneficial in several areas.
Maybe that individual that has refractory or refractory infections, ear infections or colic, though meaning not responding to traditional treatment, that would be a way to bring in that adjunctive therapy of chiropractic.
Dr. Hardy says manipulation can also help in the prevention of scoliosis, but scoliosis can only be confirmed through X-ray.
I can check for scoliosis. We can actually adjust kids that show signs of scoliosis and hopefully keep it from occurring in the first place, and catch it early and correct it.
He says it becomes a real problem once the child goes through puberty. We have more information on our webpage at WAFF.com.
Are you feeling all better now?
With your health, Bobby Shuttleworth, WAFF 48 News, Decatur.